Story 1. If you are the patient and you hear people say, "We do not know why he is not waking up," you are in a difficult situation. Story 2. I will go with the time the blade fell out of the scalpel during my husband's open heart surgery. I am not sure what the surgeon said as she quickly acted to stop the blade from being pumped through his veins, but whatever it was not good. Story 3. No, he is just being a dramatic child. Keep going. Getting a bunch of teeth removed at once because they did not fall out before my adult teeth came in like they were supposed to. It was a difficult way to find out that I do not react well to local anesthesia. Story 4. During my cesarean section, I heard them talking about weekend plans, which I guess meant they were calm and not worried. But I was lying there freaking out, like, can you guys pay attention to what you're doing? Story 5. He is still awake. Granted, it was not really a surgery. I was undergoing a colonoscopy and gave several grunts because that was the only thing I could do before they realized and, I assume, increased my anesthesia. Story 6. If I ever heard someone say, while I'm under anesthesia, just pull the plug. I have been under once, and I swear I kept half waking up paranoid I'd hear something like that. Anesthesia anxiety is real. Story 7. I was wheeled towards surgery before my husband arrived. I was in the night before. The nurse started the anesthesia, which included a drug my identical twin had a major reaction to earlier. I could not say anything as I was fading. Turned out okay, and I had no problem with the drug. However, I thought I might not wake up. Story 8. As you are going under, you hear the start of a YouTube video. Hey everyone, Chris Fix here, and today I am going to show you how to perform simple brain surgery. Story 9. When I had my cesarean section, I listened to them go over their checklist to ensure they did not leave anything inside me. It was surreal. Story 10. Doctor, why is she staring at me? Anesthesiologist, she is unconscious. Me, blinks, says, I am here. Anesthesiologist, oh no. Doctor, oh no. Me, oh no. Nurse, laughs. Me, woke up in the surgical intensive care unit 9 hours later. Story 11. I woke up during one of my surgeries where they were removing skin affected by hidradenitis suppurativa. The worst thing I heard was nothing as I tried to get their attention by blinking for a few minutes. Story 12. Oh shoot. And this was while they were getting me ready. I was getting brain surgery, and they didn't give me enough anesthesia. So when they were securing my halo on, my blood pressure shot over 200 from the pain. They thought I was going to have a stroke. They gave me more anesthesia before putting me under. Edit. I have a very high tolerance and resistance to anesthesia and painkillers. I also found out that I am non-addictive to opioids and benzodiazepines. Story 13. During dental surgery where pain is managed and I was having a root canal, the dentist said, "Tell me if you feel anything." The procedure lasted 4 hours. After filling another tooth earlier, it had been a long day for me. The dentist and assistant discussed how most dental students never get to practice root canals before they graduate because patients who go to dental schools usually do not have insurance and cannot afford such procedures. As a result, students typically only perform cleanings, extractions, and possibly fillings. The dentist also mentioned he was very close to the wall of my tooth, and if he went through, he would have to pull the tooth instead. Then the dentist left to get something, and another assistant came by to ask why the procedure was taking so long. The first assistant said they did not know and that the procedure usually does not take this long. She mentioned the dentist was new and was still gaining experience. Despite the challenges, I appreciated the care taken. The roots of my tooth were very long, which made the procedure longer to avoid drilling the wrong way and losing the tooth. Although I developed temporomandibular joint disorder for a month afterward, I am grateful he took the time necessary. Story 14. As someone who works in the operating room, surgeons are used to dealing with complications. They can work around many challenges and know how to improvise. So when you hear a surgeon just say, "Damn," that's when you have a problem. Story 15. Dental surgery, the doctor exclaims, "It's hard to tell what's what." I took his hands out of my mouth and said around the blockers, "So let's figure that out before we go back in." Huh? Story 16. She is awake. which happened during my impacted wisdom tooth operation. It was quickly resolved, but it was crazy. Story 17. If you can hear anything during surgery, I think that is terrible no matter what is being said. Story 18. Anything. If you can hear, you are not fully sedated. For example, a doctor gave me an epidural against my will. I have scar tissue in my back, and it did not work. He did not believe I knew my own body and wanted to give me general anesthesia. The epidural did not take. I heard and felt everything. Hours later, they gave me general anesthesia. If a doctor tells you he knows what is best for you, run. Story 19. This happened to me. For retina detachment surgery, the doctor said he had to use silicone oil because I was flying out, and injecting gas could make my eye explode on a plane. While waiting for the drugs to knock me out, I heard the nurse say, "Get the gas ready." My final words were, "No gas." They used oil. Story 20. Surgeon. I am going to let our student here have a try at this one. Do not look so worried. It is just a brain. We all have one. Story 21. Oh, I wonder what happens if I do this. Either that or, hand me the kidneys, nurse. What do you mean you thought I was giving them to you? What were you, oh God? Wash that gravy off right now. Story 22. Type of surgical experience. Dentist performing a complex root canal and crown procedure. I have made a mistake. My expression of horror made him realize he needed to explain. He was telling the nurse about the piece of special paper she had given him, which is used to have the patient bite down to check alignment. Story 23. I was having my cataracts done at age 40 under a local anesthetic when the eye surgeon said, "Oh no!" Halfway through, one of the legs of the new plastic lens had become stuck in the applicator. He had to cut into my eye, remove the damaged plastic lens, stitch me up, and try again with the backup lens. I was under a local anesthetic and watched the whole procedure inside my own eye, including the scissors he used to cut up the damaged lens. Because it took longer than expected, the anesthetic was wearing off by the end. Story 24. No. He is completely under, so he will not feel a thing. He cannot even hear us talking about it. I am making the first incision now. Story 25. While she is out, we will get all those medical students in, and they can take turns practicing pelvic exams for a few hours. Story 26. If I am a patient and I start hearing things during surgery, that would mean I am awake and conscious, and that is probably going to be worse than anything else I can hear. Story 27. I heard my doctor say to me before removing my kidney, "Sorry, we could not get the laparoscopic equipment, so we are just cutting you open. See you on the other side." And scene. Story 28. Not the worst thing, but during my cesarean section, one doctor said to another, "Okay, let's put the uterus back." Excuse me? What organ was where now? Story 29. Hey, where did my food go? There is the idea that the surgeon was eating while operating on you, and then the idea that a sandwich could be the new roommate of your spleen. Story 30. I had a minor procedure to remove a cyst in the doctor's office. The doctor asked if a medical student could do it because it was not very difficult. He told her, "Whatever you do, do not break it open." About 5 minutes later, I heard, oh. I ended up going to a general surgeon and having a portion of my back removed. Story 31. A new surgeon vomiting into your freshly open chest would be a disturbing sound and physical experience. Story 32. They're either going to be a very happy lady or a very angry man, but if I am going to make it to lunch on time, I cannot be bothered with finding their files. Story 33. A friend of mine told me the other day he was in Twilight for a minor procedure and heard the doctor say, "Get the crash cart." My friend groggily remembers saying, "What did you say?" The doctor responded by saying his vitals were too low and he wanted the cart just in case. Now my friend was awake enough to tell the doctor, "No crash cart." Then he explained that he had been shocked once before and did not want to go through it again. He was given an injection that brought his vitals back into the normal range. Story 34. I do not know if it counts as surgery, but I was in the operating room having an emergency instrumental birth, and I heard the obstetrician say, "Shoulder dystocia, start the clock, page the teams." During another emergency instrumental birth, I heard liquid pouring onto the floor loudly, and my partner said, "Is there meant to be that much blood? Oh my God." Story 35. Our subject looks unwell. Just tell him we treated him for an emergency appendicitis when he is awake. Story 36. Hey guys. Today I am going to show you how to perform the named surgery. Do not forget to like and subscribe. However, it is important to remember that this is your doctor watching a video, not making a video. Story 37. Woke up during a surgery once and heard my surgeon say, "Oh no, that is not supposed to happen." I thought he was referring to me being awake. He was not. Story 38. I had to have surgery on my 19th birthday many years ago, and it was actually my first operation. The whole experience was quite exciting for me at the time, and when the anesthetist and ward sister came around to talk me through the operation a few hours before, I was quite chipper, having a back and forth with them. They asked if I had any questions, and I asked what the likelihood was of the anesthesia not working and me being able to feel everything. The anesthetist told me I watched too many movies. However, the ward sister thought for a moment and said, "Very unlikely. It's only happened twice the entire time I've worked here." Well, that was it. The panic seed was planted. To make matters worse, when they came to take me down for the operation, my mom had gone to extend her parking. So I didn't have anyone to calm me down before I left for the operating theater. Cut to me lying on a trolley having a full-blown anxiety attack on the way down to the theater, while two very uninterested orderlies chatted between themselves, completely ignoring my growing hysteria. If you've ever had an operation in the United Kingdom, you will know once you get to the operating floors, it feels very different from the rest of the hospital. The corridors always remind me of horror movies set in a mid-century hospital, with low lighting and a general spookiness. Definitely didn't help my experience at the time. We get into the operating room, and one of the lovely nurses calms me down. I manage to soothe my breathing, eventually relaxing enough to be able to chat again, but I am still shaky. At that point, the anesthetist comes in, sees I'm in a state, explains what I need to do, count back from 10 and so on. And as he puts the mask on and I'm at about number 8, he leans in and whispers, "Not so funny now, is it?" Obviously, that is the last thing I remember, but it was the first thing I remembered when I woke up too. He was from Transylvania as well, which made it just that arm and a leg more sinister. I still get excited when I go for operations because I love getting a good night's sleep, but that man is always in the back of my mind, a real-life sleep paralysis demon. Story 39. Is this supposed to be here? Oh no, I dropped my gum in there and I cannot find it. I thought this patient was supposed to be male or female. Well, that's strange. Just close it up and we will tell them that we had an emergency and didn't do anything more than just cut him open. If anyone asks, the insides were like that when we found him. Story 40. I was having some work done on my carotid artery under a new procedure using local anesthetic. Halfway through, I heard the surgeon say, "Oh no," as blood started shooting out of my neck. You know how in the movies, the victim of a knife slash to the neck starts gushing blood in pulses? It was pretty much like that. Story 41. I was put under for ankle surgery but woke up in the operating room before they started. A nurse was standing over me saying something, which made me open my eyes and look at her. She said, "Oh, he's awake." The way she said it made me look around to see who else was there. I saw the doctor and another nurse looking at x-rays. The doctor responded to me, saying, "Don't mind her. She's our resident pervert." I remember thinking to myself that I had to remember what she said when I woke up. I remembered everything except that. Story 42. I woke up during eye surgery. It was fascinating to see all those small instruments in my eyeball. I heard a voice say that they thought I was awake, and the next thing I knew, I was in recovery. Story 43. I went for LASIK on one eye. In preparation for the procedure, I refused the sedative and proceeded. The doctor came out and said, "Okay, we are going to shine a light into your left eye, and that will allow us to reshape the cornea. Any questions?" Actually, it's supposed to be on my right eye. There were some discussions. Well, I'm sorry, but according to your records, you are under the influence of the sedative. so I can't fully trust what you say. Actually, I don't have the sedative. After more discussion, the doctor said, okay, we are going to shine a light into your right eye. Story 44. I had a procedure, not a surgery, for a pigtail chest tube many years ago. The doctor of radiology and the emergency room doctor performed it together. Neither had done one before. They unpacked everything and read the instructions while telling me it was all fine and that I needed the procedure done. They asked me to sign the consent form. I did not have a lot of confidence in them. I heard things like, "Do you think this is right?" Story 45. You hear the surgeon quietly whispering to herself, "I put my hand on your hip. When I snip, you snip, we snip." Story 46. Wow. I have never seen anything like this before in my entire history of performing this procedure. I proceeded to develop a large hematoma and had to undergo surgery again. 6 months later, I found out that the procedure was unsuccessful, and instead of a gland marsupialization, I had to have a gland excision. Not enjoyable, 0 out of 10, would not recommend. Story 47. In the middle of my cesarean, the surgeon said to the midwife, "Can you please push from the other end?" The baby had gotten stuck halfway. Story 48. True story. My aunt was going in for hernia surgery and she heard the two doctors arguing in the next room about it. One of them yelled, "I am not doing this." 3 years later, she is still waiting to see a specialist who will handle her case. She does not qualify for disability, so she has to try to work with her condition. Story 49. Okay, we cannot give you any more. I know it hurts. You have to hold still, very still. Now you will feel a pinch. You have to hold still. That happened during eye surgery. When I woke up, I could see it all and feel it all. Story 50. Oh, the cannula providing my sedative came out of the back of my hand just as they began putting me under. I was still conscious but very drowsy and in significant pain. Those drugs are not meant for soft tissue. Story 51. If the surgery was supposed to be under full anesthesia, hearing anything would be problematic because you are not supposed to be conscious during the procedure. Story 52. I was getting an injection into my throat through to my spine when my doctor said, "This is the first time I have ever done this." I did not laugh. Story 53. Depending on the surgery, it would be bad to hear anything at all. Cesarean section surgery. I was awake and worried about my daughter since I had been laboring for 24 hours and did not hear her cry when they delivered her. I went into panic mode for 10 seconds until I heard her little cry. Story 54. Not so much what was said, but what happened. I was just about to have my vasectomy when the surgeon fell off his stool, knife still in hand. Story 55. The surgeon answered his phone. But seriously, if you are awake, you have many other things to worry about. Story 56. I was having surgery under local anesthesia on my arm and shoulder in Colombia. Occasionally, the surgeon would look at me and reassuringly say, "All is good." At one point, he did something and said, "Oh, I think all is good." I thought I was going to die. Story 57. I had the oxygen mask on, and the nurse said I would fall asleep now. I did not fall asleep, but everything was black, and I could still hear. Then the anesthesiologist said, "Okay, now you will fall asleep." Story 58. From when I had my finger flayed open while the doctor was trying to remove glass and rocks. Where's that thing hiding? Story 59. Why can't you be careful? I told you not to do that. I heard from my parents when I was getting stitches near my chin from a bike accident. Story 60. If we finish quickly, we can get in a quick 9. I heard that as I was going out when having my tonsils removed. Story 61. If I hear anything during surgery, it means there is something wrong. The anesthesia is not working, and I might take legal action. Story 62. When I was younger, I had 4 impacted wisdom teeth removed. I remember waking up during the procedure. I was unable to open my eyes, but I could clearly hear someone say, "Jesus, so much blood." Story 63. I was getting a spinal epidural, and at one point during the procedure, I heard the anesthesiologist say, "Stupid, stupid, stupid." Story 64. She's awake. She's awake. This happened to me in the 1980s during a knee surgery with a lateral release. My orthopedic surgeon's name was Dr. Butcher. Story 65. Personal experience. Translated. Impacted molar. Wait, where is it? I already dug this part. This is deep. Give me the x-ray back. It is supposed to be there. It was deeper. The molar grew on the wrong side of my jaw. No wonder my pain area was so unusual. Story 66. It should have been right here. Maybe it is deeper. I think I was about 13 at the time. Story 67. I do not know, but when I was trying to get an epidural during pregnancy, the anesthesiologist said, "Oops." And I was like, "What?" He just said, "Oh, nothing." Story 68. My dad had outpatient surgery at a Veterans Affairs hospital to remove a cyst on his back. He was lying on the table under local anesthesia, and right after the doctor said they were beginning, he heard the doctor say, "Wow, I didn't know the skin on the back was this thick." Story 69. I had a computed tomography scan once, and the doctor said, "Wow, oh wow. Can I keep your file for future use for students?" I said sure and never knew what he was talking about. Story 70. Not during but after, the doctor said he was surprised I made it as long as I did with an infected gallbladder and a large stone in it. Story 71. Let's see what you can do, and I'll be grading you afterward. I heard this when I had a big slash on my face from going face first through a fence while tobogganing. The surgeon was a gawky-looking kid not much older than me, under the instruction of a dour old man. I was to be his in-class teaching material. Thankfully, when it was done, the dour old man gave a grudging "well done." So at least my gawky kid got full marks for sewing my face up. To be fair, you can hardly see any scar. Naturally, at the time, I was wondering what would happen if the kid failed this assignment. Story 72. A doctor saw a situation right before surgery that was not caused by him. He said, "Holy cow." I looked at him, pointed, and said, "No, you do not get to say that." We laughed afterward because everything was okay. But it was a pretty problematic situation at the time. Story 73. I'm not sure if this counts, but while I was having my emergency cesarean section, I was terrified. I could not feel anything, but I was awake. The surgeons were just talking about their daily life, catching up, and discussing the news. To me, I was so scared. How could they be discussing normal things when I was lying on a metal table being cut open, thinking I might die? On the other hand, they had probably done 4 cesarean sections that day. It was just their daily job and probably nice to catch up with a coworker. Either way, successful cesarean section, happy and healthy baby delivered. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.